Exercise and stress. Imagine a drug so powerful it can alter brain chemistry, so versatile it can help prevent or treat many common psychological problems, so safe that moderate doses cause few, if any, side effects, and so inexpensive anyone can afford it. For the last several years, medical doctors and psychotherapists have been experimenting with just such a potential wonder drug, and that is exercise. Of all the coping methods that exist for managing stress, exercise is quite possibly the best because, 1, it's possibly the best thing you can do to your body. 2, not only is it incredibly good for your physical health, it's good for your emotional health. And 3, there's a double whammy of acting as both a coping technique and a relaxation technique. Two-way connection. We've discussed the power of our thoughts, how what goes on in our mind, whether it be positive or negative, affects the body. When talking about the mind-body connection, most people think of the mind first. Psychosomatic medicine has focused primarily on how the mind can heal the body. Now, psychologists and psychiatrists are asking the opposite question: how can working out the body soothe the mind? We know that there's a two-way connection between the mind and body. What goes on in the mind affects the body, and what goes on in the body affects the mind. So maintaining a healthy body helps to maintain a healthy mind. Being physically active can have a tremendous influence on both our physical and emotional dimensions of health. And as was previously discussed, our health affects our ability to handle stress. Just like laughter, you put your body through the stress response when you exercise. So why is exercise so incredibly healthy when you're actually putting your body through the stress response? You need the stress response when you exercise. For example, you need increased heart rate and blood pressure in order to perform physical movements associated with exercise. In other words, you use up the byproducts of stress when you exercise. As I mentioned in a previous lecture, many people know that stress is bad for them, but they don't understand just how bad stress is and what exactly stress does to their body. Same thing about exercise. Many people know that exercise is good for them, but they don't understand just how good exercise is for their body, unless maybe they're a kinesiology major in the exercise science option. Here are just a few of the many incredible physiological benefits of exercising on a regular and consistent basis. Increased efficiency of the heart muscle. Stroke volume refers to the amount of blood that the heart is able to pump out with each beat. Cardiac output is the amount of blood that your heart is able to pump within a 1-minute count. Exercise increases stroke volume, which thereby increases cardiac output. So your heart becomes stronger. Decreased resting heart rate. Because your heart becomes stronger and is able to pump out more blood with each beat, it doesn't have to work as hard, meaning it doesn't have to beat as many times because of the increased efficiency of the heart. Decreased resting blood pressure. Your blood pressure increases during exercise, but after so many weeks of exercising, your blood pressure at rest drops below what it was before you started exercising. Better quality of sleep. Studies have shown that you're able to enter REM sleep, rapid eye movement, sooner and sleep for a longer period of time if you exercise on a regular and consistent basis. Increased resistance to colds and illnesses. The strength of your immune system actually decreases during exercise, but increases after exercise. Decreased serum levels of cholesterol and triglycerides. During a single bout of exercise, your cholesterol and triglycerides increase, but they drop below what it was to begin with after exercising. Decreased percent body fat. Decreased bone demineralization. Your bones become stronger and don't deteriorate nearly as fast if you're physically active. Most people think of calcium when they think of strong bones, but physical activity is just as important as calcium because calcium isn't absorbed without physical activity. Decreased rate of aging. People who are physically active throughout their lives tend to age much slower than sedentary or inactive people. Increased longevity. If exercise decreases rate of aging, then it's no surprise that exercise increases longevity. Studies have shown that those who are more physically active throughout their life live longer, and because of decreased rate of aging, they have better quality of life. These benefits are not even a drop in the bucket of how incredibly good exercise is for you. There are a gazillion more physiological benefits of exercise, but let's move on to psychological benefits. Studies have shown that exercise is an effective way to treat emotional problems of daily living. From depressed people in Madison, Wisconsin, to driven type A's in California and anxious students at Harvard, exercise is proving its healing power power. Exercise has been shown to be associated with increased perceptions of acceptance by others. Studies indicate that people who exercise on a regular and consistent basis seem to also have a higher level of self-esteem, despite whether or not they fit into society's view of attractiveness. A single bout of exercise has been shown to decrease feelings of depression and anxiety, and decrease overall sense of stress and tension. And exercise has been shown to provide people with a greater sense of overall well-being. Again, these psychological benefits are a drop in the bucket. There are tons of additional psychological benefits of exercise. Behavioral benefits. In addition to physiological and psychological benefits, exercise has been shown to be correlated with the following behavioral benefits. Decreased alcohol consumption. Studies have shown that people who exercise on a regular and consistent basis tend to drink less. This may be due to the fact that those who exercise typically tend to be more concerned with their health than sedentary or inactive people. Decreased overeating. People who exercise regularly may find that they can more easily give up overeating, which they had previously used to deal with stress. Exercise and stress. So there are tons of physiological, psychological, and behavioral benefits associated with regular and consistent exercise. So now let's talk about how stress and exercise are related. Here we have a fish in a tiny little fish bowl who says, "I swam 32,847 laps today and I'm still stressed out." Although swimming laps didn't seem to work for this fish, exercise can be an incredibly effective stress management technique. During periods of high stress, those who reported exercising less frequently experienced 37% more physical symptoms associated with stress than those who exercised more often. In addition, highly stressed students who engaged in less exercise reported 21% more anxiety than students who exercised more frequently. Results of another study indicate that employees who enjoyed a workout before going to work or who exercised during lunch breaks reported that they were better equipped to handle whatever the day threw at them. Results of the study also indicate that people's general mood improved with exercise, but they became less calm on non-exercise days. So why is exercise such a great coping and relaxation technique? Here are 4 possible reasons as to why exercise helps us handle stress. 1, exercise uses up the byproducts of stress. As I mentioned before, when you exercise, you need to have increased glucose levels, heart rate, and so forth, because you need increased power, speed, and strength to exercise or perform physical activity. As we've talked about, when you don't need these physiological changes and you don't use these physiological byproducts of the stress response, that's when your health suffers. 2, exercise is thought to be a relaxation technique because there are very powerful hormones called endorphins that are released in your brain when you exercise. These hormones produce a euphoric feeling, and believe it or not, can actually mimic the same feelings that are produced by use of illegal drugs such as cocaine. After so many minutes of exercise, about 15 minutes of moderate aerobic exercise, these hormones kick in and produce what's called the runner's high. Exercise is now used as a treatment for depression because of the power of these hormones. Number 3, exercise can act as an effective distraction. Exercise is thought to be a coping technique because it helps clear your mind. It gets you away from the stressful situation, which often results in a clearer perspective. Number 4, there appears to be a training effect in people who exercise on a regular and consistent basis. In other words, those who exercise are used to going through the stress response. So it appears as though those who exercise don't go through the stress response to stressors to the same extent that non-exercisers do. And just an FYI, take a look at results of a survey done by the National College Health Association. Students who reported that they had exercised 3 days in the last week were less likely to report that stress affected their academic performance. Exercise and relaxation. As I mentioned, exercise can actually act as a relaxation technique because of relaxation-inducing hormones that are secreted during exercise. That's why, for many people, exercise acts as a tranquilizer. Researchers are finding ways to tailor frequency, duration, and varying types of exercise for different psychological problems. It should be noted that exercise is not meant to replace appropriate psychiatric treatment, but it can be a very useful addition to treatment. Running and meditation seem like completely opposite states, one strenuous and the other serene, one physical and the other spiritual. Yet both are considered to be paths to altered consciousness, and together they affect both mind and body. Dr. Herbert Benson, a cardiologist, found that exercisers who meditated as they worked out burned less oxygen, which means they utilized energy more efficiently. Monks, using a similar approach and concentrating on a mantra or repetitive phrase, have run distances of 300 miles over mountain trails in less than 30 hours. When most people think of the term exercise, they think of aerobic types of exercise or strength training. Many people don't think of stretching as exercise, or they don't think of their flexibility as having anything to do with their fitness level. Flexibility is actually one of the components that's used to measure or assess our fitness level. Remember that muscle tension is pervasive all throughout the body when we're stressed. We've talked about how effective massage therapy is, but stretching can be just as effective, and unlike a professional massage, it's free. First of all, did you know that muscle tension affects nerves, blood vessels, organs, skin, and bones? Simple stretching exercises has been shown to provide pain relief, increase energy levels, increase flexibility, which is considered to be one of the components of fitness, improve range of motion of the joints, increase blood circulation, enhance relaxation and decrease stress levels, enhance muscle coordination, improve posture, and increase a greater sense of overall well-being. There are several benefits that have been shown to be related to stretching, one of which is acting as a stress reliever. Another note about exercise or physical activity and stress. Unfortunately, stress and physical activity have been shown to be reciprocally related. The more stressed people are, the less likely they are to engage in physical activity, and vice versa. The less stressed people are, the more likely they are to engage in physical activity. But a meta-analysis has shown that people who are habitually active exercise more in the face of stress. Those in the beginning stages of exercise less when they're stressed. So if you're not in the habit of exercising right now, it might be a good idea to start. The supplemental video for this lecture is Exercise and the Brain and is about 4.5 minutes long and is another really good well-cast video. Key points. There is a two-way mind-body connection. The mind affects the body and the body affects the mind. There are tons of physiological, psychological, and behavioral benefits associated with exercise or being physically active. Those who exercise aren't as stressed or anxious compared to those who don't exercise. Possible reasons why exercise helps us handle stress are it uses up the byproducts of stress, it causes the release of powerful relaxing hormones, it distracts a person from their troubles, and exercisers don't appear to experience the stress response as much as those who don't exercise. And that's it for this lecture and for the coping techniques. We've talked about creative problem solving or how to nip our stressors in the bud and decrease or even eliminate actual stressors. We've talked about cognitive restructuring or changing our thoughts and perceptions, which thereby inhibits the stress response. We've talked about how to communicate better, how to manage our time, and we've talked about exercise as both a coping and relaxation technique. Now let's talk about relaxation techniques or how to relax.